we have Dr. Gayatri here today, my favorite physician, and I have a few things that I need to ask her. So Gayatri ma'am, recently I am seeing a lot of young girls outside your OPD. Initially it used to be the senior citizen or the middle-aged people, but now I see a lot of young girls. You want to tell me more about it?
Yes ma'am, what happened is earlier we used to have a lot of elderly patients coming up with the diabetes, hypertension, heart failure, all of these. But then these days a lot of young people are coming with a lot of obesity related issues, metabolic related issues with irregular cycles, and post that where we've investigated and found that a lot of people are suffering with the PCOD, because of which they are suffering a lot of other problems also. So basically these young girls coming up in their early teens and middle age, what happens is they have a lot of abdominal obesity and irregular cycles. Basically, they come with irregular cycles, and then we start evaluating them with the thyroid and other hormonal assays, USG and all. We find that they have PCOD, and because of which they've been having such problems, and then pregnancy-related issues, they're not able to conceive. They come to that and we get diagnosed PCOD.
Okay. So, ma'am, you want to tell us more about what are the complications associated with PCOS and why not only an obstetrician, a physician, an endocrinologist has to be involved in the management of the same?
Yes, basically this PCOD is more related because of insulin resistance and hormonal imbalance in your body. So the thing is, along with the PCOD, it is not only the obstetric complications, but there are a lot of other risk factors and complications also associated with PCOD. So basically your obstetric complications, as you know, pregnancy-related complications where the patient develops gestational diabetes, pregnancy-induced hypertension, the baby can have a low birth weight baby secondary to hypertension during pregnancy, or the baby can be big, fat baby secondary to GDM, and a lot of both maternal and child-related complications are there.
True.
And excluding these pregnancy-related complications, conceiving itself is a big problem. A lot of patients come up with primary infertility, secondary infertility because of PCOD. So what happens is they have these endometrial abnormalities, anovulatory cycles, irregular cycles, because of which they are either not able to plan exactly for their pregnancy, or the pregnancy is not happening. So all these are obstetric-related complications. Otherwise, your cardiovascular risk is also increased with PCOD because of the insulin resistance and the very bad lifestyle what people are having these days. So with increased risk of habits like smoking, taking alcohol, not consuming healthy diet, no physical activity, sedentary lifestyle, the risk of diabetes, hypertension, dyslipidemia is increasing because of these habits. Secondary to which a lot of cardiovascular complications are happening. Earlier it used to be like females are at reduced cardiovascular risk because of their hormonal protection. But these days, because of these hormonal imbalance and PCOD, a lot of young females are also suffering with cardiovascular related risk. So all these needs to be taken care of, and more of these oncological related complications are also seen with PCOD, where patients land up with endometrial carcinoma, ovarian carcinoma, uterine carcinoma, all of these are seen, and a lot of patients are having psychiatric illness because of this. They land up with depression because of these hormonal imbalance, a lot of anxiety, panic attacks, and all of these are very common these days associated with PCOD.
So obviously, there's a lot of complications associated with PCOS. And can you also give us a little bit on how exactly we manage these complications or these conditions associated with PCOS?
Yes. See, ma'am, basically we have both pharmacological and non-pharmacological treatment for PCOD. Obstetric complications, as you know, the treatment is again regularizing their cycles and IVF treatment, and all of that you can go ahead. But then these non-pharmacological treatment is very important for younger people, because you'll not be able to put them on medications for a long time. So what we can do is suggest them with lifestyle changes, exercises, dietary changes, and all of these. So we'll have to ask them, motivate them to have not sedentary lifestyle, increase their physical activity of at least 150 to 180 minutes of physical activity per week, and counsel them about their diet. Give them a healthy dietary advice, and where they take more of proteins, more of fiber, less carbs, less fat, high antioxidant rich fruits. All of these are available, and we should encourage people to start taking all of that. And otherwise, you put them on chlorpheniramine for regularizing their cycles. For insulin resistance, you can put them on metformin, regularize their cycles, give them counseling. I think that should be taken care of. Constantly, they need to be screened. They getting diagnosed for PCOD at around 20-30s. They are at increased risk for all of these complications. It is definitely possible. So these patients needs to be counseled about what all complications they will go through and what they need to be in check for the rest of their life. So routinely they'll have to check their sugars, their cholesterol levels, BP needs to be checked, the weight needs to be under control. Constantly you'll have to tell them that what is overweight, what is obesity, what is grade in obesity, what is grade 2 obesity, what will happen, why is abdominal obesity so important. Patient needs to be counseled about that, and they need to check all these investigations. They need to be under constant monitoring so that they don't land into any other complications. PCOD definitely is a treatable. They can revert to the normal hormone levels and lead a very happy and healthy life, but people need to be counseled and treated accordingly.
Definitely, ma'am. The last question from my side will be, is there any timeline? If as an obstetrician I'm going to see a case of PCOS, when is it ideal for me to tag the patient to you? Or should we do it together? Is there any timeline like that?
Or there is no definite timeline as such. The thing is, once you see, people usually come to you because they are not able to conceive.
True.
Like post-marriage, they are not able to conceive. They've been trying for a long time.
Very
it's
true.
not happening. It is then when they come to you and then you diagnose and send to us, or people come to us with obesity and diabetes issues. So we diagnose and we send to you. It's a multidisciplinary involvement. Multidisciplinary involvement. All of us needs to be under constant touch with these patients so that your specific department disciplinary actions you can take and give them a counseling and let them lead a very happy life.
Perfect. And lastly, you want to tell our girls, the young girls, the importance of managing this PCOS.
See, PCOD, these days a lot of young girls think it's a very big problem which cannot be solved at all, but it is not that way. It can definitely be reverted with your lifestyle changes, your dietary changes. Be under constant touch with all of us. We will help you people with what you're supposed to do.
Thank you so much, Gayatri madam. And for any other further queries, you can write to us and we'll be more than happy to answer any of your questions. Thank you.
Thank you.